Let's discuss hair loss. It turns out in aesthetics, for both men and women, the number one concern for both is not wrinkles or pigment or saggy skin. It's actually hair. So hair thinning or hair loss occurs with stress, occurs with aging, and it affects both men and women. However, it affects them differently. So let's look at this picture, and with male pattern hair loss, you'll notice that as long as you have hair follicles, we can do something. If you're bald, shiny bald, then the Carifactor microneedling will not work for you. When we look at women, women are luckier. They don't really go bald. They thin a lot. So for females, we're having a lot more patients coming in for this. I don't know what the reason is, but maybe from stress, maybe in the workplace, or just modern life, we're noticing we're actually seeing more women than men coming in for this. It's very effective. Let's talk about how this works. So when we inject the growth factors into that area, it's like watching grass grow. So we recommend one treatment every month for 3 months. At that point, you'll start noticing if it's working for you. And please know that 80% of people respond to this. There is a 20% chance that this may not work. So we'll do our best. We always recommend starting you on a supplement called Nutrafol, and that's to prevent hair loss. So the Nutrafol works really, really well for retention. We had considered things like minoxidil or Propecia, but the side effects are cardiovascular. And as we get older, I'd rather not sacrifice brain or heart function for your hair. Now, Nutrafol works really, really well, and it's safe. It's got a combination of biotin, saw palmetto, turmeric, and I've noticed it in myself. I was thinning. My wife, interesting, she would leave a bundle of hair. It almost looked like a squirrel after every shower. And she started Nutrafol, and suddenly it got smaller and smaller. So it definitely works. And then if you want to stimulate the new hair, this is where we recommend PRP, where we inject your platelet-rich plasma into the scalp to stimulate hair growth. Remember, in this treatment, you require 3 treatments once a month. After that, depending on how satisfied you are, we recommend doing 1 treatment every quarter. Notice the hair growth and stimulation in this young lady, especially in the front area, and again in the other image. So if hair thinning is something that concerns you, this is a safe, non-surgical alternative. Aloha.